is Ahmed Bello. I'm a student of Texila American University. I'm making a presentation on illness perception and delay among newly diagnosed tuberculosis patients from Kano region, Nigeria. Summary. Delay in seeking treatment at the hospital is an important problem in TB control. It affects the prognosis of the patient as well as the transmission within the community. Previous studies have shown different individual and health system factors to be related to delay. However, none of these studies quantitatively assess patients' belief and perception related to delay when experiencing symptoms. In this study of illness perception, the treatment choices and delay among newly diagnosed patients, 128 patients from the Kano region, 25% of the patients delayed less than 4 weeks, 37% delayed from 4 to 12 weeks, and 38% delayed greater than 4 weeks. Patients did not fully understand fully understand their disease, and the majority of the patients used 2 to 3 other types of treatment before presenting at the hospital. Mostly the patent medicine vendors, the self-treatment, herbalist, and also mosque. Weight loss, chest pain, loss of strength, persistent cough, fatigue were all common to be perceived symptoms related to TB. Cultural factors such as from God, taking cold drinks, air populations were perceived as most likely causes of TB. Regression analysis showed that delay was related to unemployment and negative emotional representations. This information is valuable for healthcare practice, while it also provides input for the effective TB program. So what? Yes, because no studies conducted in Africa using the illness perception questionnaire amongst the TB patients. So this was the first study we could see where we used the illness perception questionnaire revised in this study. Previous studies actually focused on perception or belief about TB in African groups, mainly a qualitative approach. So some, use non-standard questionnaires, non-patient populations, but a qualitative method is highly informative. Why? Because it cannot be used to test relationships with delay. Non-standard instruments limit the comparison of the result with findings of others, and non-patient populations are useful to function as a proxy. So this study was the first when examining illness perception of TB patients with TB patients from rural Nigeria and the relationship with patient delay, while taking into factors previously related to delay into account, such as the treatment choice and the social demographic factors. So this approach may will help to better understand patient delay and eventually improve early presentations. Background. Tuberculosis is the second leading cause of death from an infectious disease worldwide, with an incidence rate of about 118 in 100,000 populations in high-burden countries such as Nigeria. Treatment is most successful when appropriate care is provided shortly after experiencing symptoms. But there's always a delay. Patient delay here is defined as the time interval in days from the onset of cough with or without any other symptoms of TB to the time of presentation at the hospital. And a time period of 1 month is typically used as a cutoff for delay, as we've seen. Theoretically, the way patients, so previous previous studies showed that travel time, distance to health facilities and living in rural area were related to delay. However, these studies did not focus upon individual factors related to delay when experiencing symptoms. So therefore, we aim to gain a better insight, more insight into the relationships between this illness perception and the patient delay in these TB populations, while adapting a quantitative approach in which factors previously related to delay were taken into account. So what methods were used? This is a cross-sectional study conducted amongst newly diagnosed patients visiting the infectious disease hospital, which is called the IDH in Kano State, northern Nigeria, for the first time for treatment of their TB symptoms. So the study sample consisted of 128 newly diagnosed patients visiting the infectious disease hospital for the first time. So these are just for the first time newly diagnosed patients. Patients were included when they have had a confirmed diagnosis of TB and were aged between 16 to 65, and they are able to speak English or Hausa. And if they are not, then they are excluded from the study. The diagnosis of TB was based on clinical case detection and confirmation by sputum smear microscopy. So when the patient come, upon arrival at the hospital, the patient explained their symptoms to a doctor, after which they were now directed to a lab for a sputum smear microscopy. When the patient were confirmed and diagnosed of a positive test of the fast bacilli in their sputum, then they were now referred to an HIV screening. So all of these procedures were part of the standard care in Nigeria. So after screening the patient, they were referred to the researcher on site to check for the inclusion or exclusion criteria for this study. For patient delay, participants were asked to recall in days when symptoms of their current cough episode first started. So to improve the accuracy and reduce recall bias, so patients were asked first generally about their illness in general and specifically about their symptoms. So we categorize delay into three groups. The first group is no delay. These are patients who reported to the hospital from the onset of cough to 4 weeks to 28 days. While group 2 are moderate delay, patients who reported to the hospital from 4 weeks to 12 weeks. And the third group is severe delay, patients who reported to the hospital after 12 weeks. For the treatment choice, patients were asked whether they sought help before presenting at the hospital. If so, where did this help, where was it sought from, and in which order the treatment was sought? For the illness perception questionnaire, according to the common sense model, the illness representation is built up by 5 dimensions, which can be measured by the illness perception questionnaire using 8 sub-skills. We have the identity, we have the illness coherence, the cure and control, the acute chronic timeline, and the causal beliefs. So the results. And for the patient characteristics, an overview of the patient characteristics and background variables are presented. 128 patients with a mean age of about 31 to plus or minus 12, range between 16 to 65 years old were included. 57% of them were male, 54% were married, and 52% were employed. 37% of the patients never attended school, and 48% finished secondary school or more. Knowledge of TB was generally low. About 2/3 of the patients had heard of TB, while 1/3 knew that coughing of blood was one of the symptoms. Half of the patients knew that TB is a transmissible disease, and 42% knew it is treated free of charge. For patient delay, 25% of the patients showed up at the hospital within 4 weeks of the onset of symptoms. When they show within 4 weeks, that means there's no delay. While about 37% shows that they were within the moderate delay, now between 4 to 12 weeks, and 38% showed up after 12 weeks. For treatment choice, we could see that about 105% of the 128 that were sampled, that's about 82%, used other treatments before presenting at the hospital, meaning they had sought treatment elsewhere before coming to the hospital. Patients choose between 1 and 5 types of treatment before presenting at the hospital. For the illness perception, over 75% ascribe their symptoms to weight loss, chest pain, loss of strength, fatigue, or elevated temperature to their TB. 88% of them perceive the causal factor from God as likely cause of their TB. Taking cold drinks and air population were perceived as the second and third most likely cause of TB. We could see from the table, we could see from figure 1 here, this illustrates the types of treatment choices patients made, with most used types of treatment before presenting at the hospital being the PMVs. These are the patent medicine vendors, which we can see here. The patent medicine vendors. Self-treatment, herbalists, and others were also part of it. The type of treatment patients choose did not differ between the delay, with the exception of the choice of the herbalist, which was significantly higher for the extreme delayers. There was no typical pattern in order that was found for the choice of treatment. So if we look at table 2, look at the associations between the delay and the social demographic factors and the treatment choice and the IPQ. The relationship between delay and the social, economic, and background variables were examined, and delay did not differ significantly by gender. However, only employment status, which will have a p-value of 0.02, was significantly related to delay. And the last table was logistic regression, to which shows was among the 3 groups was associated with perception of clinical timeline, serious consequences, and the emotional representation. Pain is an experienced symptom that was related to delay, and none of the causes subscales was related to delay. For the logistic regression model, the individual predictors significantly related to more delay was unemployment and negative emotional perception. Conclusion. Our findings add to the literature the relationship between delay, emotional illness, perception, and employment status in TB, and confirms the importance of the PMVs, which are the patent medicine vendors, showing that we actually need to link up with them in actually taking
Hello.
Okay. So this is the first study to use the illness perception questionnaire revised in relation to delay in TB in Africa, providing information to healthcare practice and input for preventional programs. Future steps. This study supports the concern expressed by others that there is a direct need for the TB program to explore ways of engaging the obliquous PMVs in order to decrease delay in obtaining appropriate TB care. There's a need for the government to actually make use of the PMVs to actually reduce the delay of TB patients. This approach may help to better understand patient delay and eventually improve early presentation. This information is valuable for healthcare practice, while it also provides input for an effective TB control program. Thank you very much.